Hello friends, welcome to SERUMMEDICO. In this video we are going to see about the anatomy of the heart. Before going to in detail, there is a small MCQ. All veins drains into coronary sinus except the right cardiac vein, middle cardiac vein, anterior cardiac vein and of the above. Watch the full video and comment the answer in the comment box. Let's go in detail. First, anatomy of heart, anterior side. This consider this as a heart. This is right atrium. This is right ventricle. This is left ventricle. It is the anterior arterioventricular groove which separates the right atrium and right ventricle, and this is the anterior intraventricular groove which separates the right ventricle and left ventricle. This is the anterior surface of the heart. Right atrium, left ventricle and right ventricle, right arterioventricular groove and the anterior intraventricular groove. This is the posterior surface of the heart. This is left atrium, right atrium, right ventricle and this left ventricle. This is the posterior surface. So it is the posterior arterioventricular groove which separates the left atrium, right atrium from the left ventricle, and this is the posterior intraventricular groove which separates the right ventricle from the left ventricle. This is the posterior surface of the heart. Next, this is an important MCQs. Base of the heart is formed by left atrium and right atrium, but mainly it is formed by left atrium. Apex of the heart is mainly formed by left ventricle and right ventricle. Major part is formed by left ventricle. And structure posterior to the sternum is right ventricle. It is important MCQ. Many times it has been asked. Structure just behind the sternum is right ventricle. It's not right atrium. It's right ventricle. Then the right ventricle, it is 0.5 centimeter. The left ventricle is 1.5 centimeter, and the right ventricle has 3 papillary muscles and the left ventricle has 2 papillary muscles. This repeated MCQ has been asked. And Purkinje fibers are modified cardiac muscles which will be discussed in the physiology of the heart. Next, the blood supply of the heart. The heart has 2 blood supply, right coronary artery. Right coronary artery. The right coronary artery gives 2 branches, right posterior intraventricular branch and right marginal branch, and another is left coronary artery which gives 3 branch, anterior intraventricular branch, circumflex branch and left marginal branch. Targets anastomosis, and we will discuss in detail about it. The right coronary artery supplies right atrium, right ventricle, SA node and AV node, left bundle office, and posterior one third of intraventricular septum and apex of the heart. The left coronary artery supplies left atrium, left ventricle and anterior 2/3 of intraventricular septum and apex of the heart. This is the blood supply of the heart, and apex is mainly supplied by left coronary artery, that is left marginal branch. So apex is mainly supplied by left marginal branch, which is a branch of left coronary artery. This is important MCQ. And in 85% people, the posterior intraventricular artery is a branch of right coronary artery. So most of the people will be having right dominance. This posterior intraventricular branch is the branch of right coronary artery. So many people are having a right dominance, but in some people, if it is a branch of circumflex artery, then it will be LCA dominance. If both are giving the branch to the apex, then it is co-dominance. Right dominance, left dominance and co-dominance. Then venous supply of a heart. This is small cardiac vein and middle cardiac vein, great cardiac vein, coronary sinus supplying the posterior surface and marginal vein. The coronary sinus drains into the right atrium. It is important MCQ. Coronary sinus drains into the right atrium and all veins drains into the coronary sinus. All great cardiac vein, marginal cardiac vein, middle cardiac vein, small cardiac vein. All cardiac vein drains into the coronary sinus except this anterior cardiac vein, also known as the Spatian vein or venocardial intermittence. These veins directly drain into the right atrium. It is an important MCQ. All veins drains into the coronary sinus except anterior cardiac vein or the Spatian vein and venocardial vein. They directly drain into the right atrium. And another MCQ is coronary sinus drain into the right atrium. And it is important chart which will be asked as many MCQs. Which artery lies in the anterior interventricular groove? It is left ascending artery. And which artery lies in the posterior interventricular groove? We have seen that no, right RCA, right posterior interventricular branch. And which vein accompanies the left ascending artery? Great cardiac vein. And which vein accompanies the right RCA? Right posterior interventricular artery is middle cardiac vein. And which vein lies in the posterior arterioventricular groove is coronary sinus. It is important MCQs. Which vein accompanies LAD, which artery accompanies MCA, and which vein lies in the posterior AV groove. Next is another two sinuses are oblique sinus, which lies behind the left atrium, and another is transverse sinus. It lies between the ascending aorta and pulmonary trunk, and the nose supply of the heart is T1 to T5. Next, an important triangle. It is known as triangle of Koch. The boundaries are tricuspid valve and opening of coronary sinus and tendon of Dorado. The content is AV node. And the blood supply of the triangle of Koch is right coronary artery. It is very important MCQ. The boundaries of the triangular Koch are tricuspid valve, opening of coronary sinus and tendon of Dorado, and the content is AV node, and the blood supply of the triangular of Koch is right coronary artery. And another one is SA node. SA node lies at the junction of the right atrium and SVC. Right atrium and SVC. That's all.